We still have some folks jumping in. So I'd like to just take a moment and welcome everyone and introduce myself in Studio B. And then I'll provide, I'd like to introduce our special guest presenter today. So hi, everyone. I'm Jennifer Siramboli. I'm the founder and CEO of Studio B. Studio B is a WellTech company serving corporations, organizations, and people with live and on-demand resources and programs to integrate well-being into our busy personal and professional lives. I'm so happy that each of you made this webinar a priority today, and I'm delighted to welcome you to Mindfulness for Mental Health with Dr. Tracey Meyers.
All right, 5 more.
Dr. Tracey Meyers is a licensed clinical psychologist in the states of Massachusetts, Connecticut, and New York. In addition to being a senior facilitator at Studio B, Tracey works at Lawyers Concerned for Lawyers, a legal assistance program serving lawyers, judges, and law students. Prior to joining LCL, Tracey worked for the state of Connecticut Department of Mental Health and Addiction Services, where she spent over 16 years working in inpatient and outpatient mental health settings. Tracey has a strong commitment to integrative medicine for mental health and wellness, and she leads mindfulness and yoga programs for groups, individuals, and professionals in the workplace. In addition to her background in psychology, she's also an advanced yoga teacher, certified yoga therapist, and a meditation teacher. Tracey has authored several publications, including articles and book chapters about integrative medicine, post-behavioral support treatment for different mental health conditions, and developing collaborative relationships in healthcare settings. She has an upcoming book coming out in January 2022 entitled Transformational Healing Through Yin Yoga Therapy, which is an extensive guide to utilizing yoga and meditation to support mental health and well-being. I'm certain that you'll enjoy her presentation today, and I'd like to encourage each of you to stay connected with us at Studio B to learn about how we can support you and your team at work, at home, and in life. So without much further ado, I'd like to welcome Tracey. Tracey, I'm so happy to have you here with us today, and I'd like to turn it over to you.
Thanks, Jennifer. So nice to be here and part of this community. And if you're new to Studio B, I'm super excited that you came to join us today. So today we're going to cover kind of a wide, vast topic around mental health, and specifically looking at integrative modalities, innovative ways to look at treating things like anxiety, depression. We'll do a couple of brief practices and also save time for questions. So along the way, as things come up in your mind, you feel free to use chat. I may integrate that while I'm speaking or save some time at the end for questions. Okay. I'm going to share my screen and dive in. All right. Okay. So today we're going to talk about integrative psychotherapy and mindfulness meditation. So we'll be speaking about mindfulness-based therapy, which some of you may not be familiar with that term, MBTs. We're going to talk about stress and the nervous system, and a lot of what many of us are going through, especially over the past year, in terms of anxiety, depression, insomnia, and other stress-related challenges. I'm going to talk about the research. What does the research say about mindfulness and mental health? And finally, how we can develop our own mindfulness practice to regulate different emotions that we may be struggling with. So I'm going to take a moment now. And so we talk a lot about like, welcome to this moment. And how do I actually become present? And am I doing it right? That's the number one question people ask me when I teach meditation. I can't do it. I'm not doing it right. So the good news is there's no way to not do it right. And so let's practice together just for a moment. So finding your feet on the floor and just noticing how you're sitting, just checking your body right now. Notice if your feet are not touching the floor, can perhaps finding a little more space to do that, sitting nice and tall, relaxing the shoulders back and down. And if you're comfortable, either closing the eyes or keeping a soft gaze, and begin to take some breaths, perhaps a little bit deeper than your natural breath, just to connect with the fact that you're breathing. Notice the in-breath and the out-breath. We breathe about 18,000 times a day, but often we don't even notice our breath. Just becoming familiar with this breath. And this breath. Notice when the mind wanders, and then gently bringing it back to the next breath. Each time our mind wanders, it's an opportunity to come back. That actually is meditation. So taking one or two more integrative breaths. And then when you're ready, you can begin to slowly open and close the eyes a few times. Maybe a little stretch, a little relaxing of the shoulders and coming back. So these little incremental moments where we can pause and actually notice what's happening, that really is the present moment awareness. So I want to speak now about mental health. Many of us in ourselves, and we recognize this in our family members or work colleagues, we know that people are under a lot of stress. When I meet a new client, often the first thing they'll say to me is, I'm tired, I'm exhausted. I don't feel myself. So those are some of the key words that I usually recognize as this person may be struggling with mental health challenges. If we look at it from a worldwide perspective, we see the numbers are pretty startling. 970 million people worldwide have some type of mental health or substance use disorder. Anxiety is the most common mental illness around the world. And in the United States, the numbers before the pandemic were about 1 in 4. So really common. Major depression is the second most common, followed by substance use and some of the major psychiatric conditions. The mortality rate with people with mental health issues is significantly higher than the general population for a variety of reasons, from co-occurring physical illnesses, suicidality, use of medications. There are many reasons why, but it is both a physical and mental challenge. So right now, even before COVID in the US, these are US statistics, we can see that about 20% of our population struggles with mental health. And even more significant, I really want to highlight this, is that 24% of people that have mental health issues have unmet treatment needs. And during the pandemic, those numbers are even higher, somewhere between 30 and 40%, which means that although people are struggling and are having significant interference in their daily life due to mental health issues, there are challenges in getting treatment. You think about like another condition like high blood pressure or diabetes, something that if you were diagnosed, the likelihood is you'd have some access to treatment, hopefully, and be able to, utilize an intervention. So in mental health, 1/3 of the population and maybe more isn't getting help for what they need. So that's really significant. So there's an access issue on top of just an overall overwhelming need for services. We look at suicide rates, especially among young adults. So even in states with a lot of access, like the Northeast, we have 1 in 3 folks going without treatment. So let's look at the pandemic itself. We know that there's been a surge of mental health issues during COVID-19 pandemic. So these are UK and US statistics. So as the pandemic began in that 2019, prior to the pandemic and then early pandemic, 2019 to 2020, we're seeing about 10%, 11% of the population having anxiety or depression. And now look at the post or during the pandemic in 2020, In UK, it's about 20%. In the US, 42. A recent study by the American Psychological Association had the numbers even closer to 60% of people were experiencing symptoms of depression. So that's high, right? So that's 1 out of every 2 people. And if you pause for a moment and think about yourself, a loved one, your friends, colleagues at work, you probably could easily think about people that you know that are struggling, right? And the reason these statistics are important are to normalize what is sometimes not spoken about. People will come to me for a consultation. They'll often say, I feel sheepish. I feel embarrassed. I had a woman just yesterday say, I feel sheepish coming to you because my life seems like it's going okay. I've got a really good job. I have, my kids are healthy. Yet she's struggling. So it's this, difficulty in acknowledging and sharing, fear of stigma, not sure what to do, but a lot of people are struggling and they're not able to access help. So let's talk about what are some key symptoms to notice. And the idea is to look not just within yourself, but also people you know. I work with a lot of attorneys and law firms, and many times people come to me and say, I'm really worried about this colleague. I haven't seen them, or I only see them on Zoom, and they turn the camera off, and I have no idea if the person is doing okay. What should I ask my colleagues, or what should I ask my friends? So both for yourself or others, these are some key things to think through. Sleep is something that gets affected significantly by mental health issues. Your eating and nutrition. The gratification, looking at do normal things that I used to enjoy no longer bring me pleasure? How difficult is it to get up out of bed? Missing deadlines and work, or that social isolation with during the pandemic is easy to do. It's easy to ghost, right? And to not get on calls or to hang out in the background. How much are you impacted by anxiety? So does it interfere with things that you'd like to do? And as people are reboarding and going back to work, how much is anxiety playing a role in going back to, taking public transportation or, going into a building? Do you no longer enjoy your job or things in life? And then in terms of substance use, and you could substitute any of this. You could substitute television watching, you could substitute sugar, you can substitute any kind of behavior that helps to kind of get away or escape from the daily struggles. So these are signs of depression and anxiety. And just to think about, now all of us are going to meet some of these at different times, right? And this is just a kind of a self-observation. But if you're noticing you're meeting more of these criteria, and particularly how much is anxiety, depression, or substance use impacting your daily life, your functioning day to day? So I want to look at this in a kind of overall holistic view. Many times people feel guilty. They feel like there's something wrong with them, that they're struggling with anxiety or depression. And when we think about the nervous system, it can make a lot more sense why we're struggling and also help us in terms of developing a toolkit and a path to help alleviate some of these struggles. So I'm going to talk a little bit about this stress response because anxiety and depression are stress responses in the nervous system, in addition to other factors like genetics, environment, etc. But this overall simple view is this idea that when we have a demand or demands or stressors, we have to respond. And how we think about that stressor, do we appraise it as overwhelming or do we appraise it as manageable? Right? So you can think about anything like going to the supermarket, right? For some people, it's no big deal. So we appraise a situation as routine, maybe even pleasant. For other people, going to the store may be dangerous, stressful, potentially could cause illness. And then the appraisal is negative and it can become overwhelming. So how we think about a situation impacts how we feel in our body. It can cause a reaction in the nervous system. And every time we have a negative thought or a worried or anxious thought, it sends a little reaction into our system. Too much of that reaction over time can cause what many of you are familiar with, this fight or flight response.
Diagnosed in California.
So when we think about, and here's another diagram, you have a stressful situation. Now, thinking about the COVID pandemic, how that's been a chronic stressful situation. but you have a major exam, a date, trouble with finances, COVID, illness, and then we appraise it. And then depending on how we appraise it, we can have an emotional response, a physiological response, which is that fight or flight response, and a behavioral response, which is sometimes a negative behavior like substance use or lashing out at someone else. So when we think about a mental health condition like anxiety or depression, we want to think about it in terms of it's a response to stressors, right? It's a response to stressors. So instead of saying we're weak, we're not strong, there's something wrong with me, other people navigate better than I do, if we think about our unique system, how we think about a situation can create emotional, physical, and behavioral responses. So this slide is really important. And when I learned about this window of tolerance idea, it comes from the trauma research. So Pat Ogden, who created sensory motor psychotherapy, Daniel Siegel, Bessel van der Kolk, those folks that are in the trauma research, describe this idea that stress in the nervous system can have an impact both in the moment, but also on a wider lens, on a more chronic level. So a window of tolerance, imagine the most beautiful bay window overlooking the ocean, for example, and it's wide open and you can hear the ocean, you can smell the sea, there's warmth and light coming in. It's a wide window of tolerance. This is like when we're functioning at our best, like we're navigating day-to-day life without any difficulties. We can handle stress, things come, but we're mobilized and able to handle it. We have good thinking skills, our reactions are appropriate to the situation, we're mentally focused, right? And then when we have a stressor, we're able to manage it if the window of tolerance is wide. But with enough stressors, we keep going into this red zone called hyperarousal, that fight or flight response. And if we're in that red zone several times a day, 6, 7, 8, 9 times a day, 10 times a day, over time, that red zone gets larger and our window of tolerance starts to diminish, right? It gets smaller. And what happens over time is that our window of tolerance shrinks to the point where even small things set us up into a hyperarousal. How many times has that happened to you where you're like, God, a small little thing like, a missed text or, the car has to get an oil change or your child's saying mom for the 100th time. But why does that 101 first time so difficult? It's because we're in this red zone. Our window of tolerance has shrunk. People that have experienced trauma, especially early trauma, but even ongoing trauma, often struggle with a window of tolerance that is smaller than what our natural window of tolerance was. The gray zone is called hypoarousal. For some of us, when we're overtaxed, we go into a more numb, depressed, or lethargic place. So our nervous system is almost shutting down. And many of the people I work with go back and forth between that red zone and that gray zone. And either way, that window of tolerance begins to shrink. So what do we do when that happens? And the good news is it's not a permanent state. We actually have things that we can do. And you can see on the slide on the left side using mindfulness and grounding and breath work to help us when we're struggling in that red zone. And in the gray zone, mindfulness, again, breath work and physical activity. So that is part of what we're thinking about in terms of mental health now, that it's not just about looking at medications and psychotherapy, although that is really important. And I'll talk about kind of that holistic approach. But we see that when we can get the nervous system back online, where our window of tolerance has more capacity, then we're able to navigate life's challenges with more ease. This is another slide I really like, again, looking at trauma and window of tolerance, idea of when stress and trauma shrink your window of tolerance, we get thrown off balance. And again, working with a practitioner, the challenge is that it's really hard if we have really undergone a lot of trauma or our window of tolerance has really narrowed to do it on our own. So using, meditation and yoga can be very helpful, but also having someone to guide you can be really instrumental in improving when we're stuck. So this is another slide just looking at stress changing the brain. The reason I'm talking about the nervous system and the brain so much in this presentation is to really help you understand it's not your fault. And instead of feeling sheepish, shameful, or feeling like there's something wrong, we can just understand it from a neuroscience perspective, just like we would with diabetes or a heart condition, right? So what happens to stress in the brain? The prefrontal cortex has atrophy. Atrophy means cell loss, shrinkage. And atrophy in the brain is not a good thing. We never want to have things atrophy. We want to have a robust white matter, gray matter, neural connections in the brain. The prefrontal cortex, when it shrinks, impacts our ability to make decisions, to problem solve. It makes it more challenging to have empathy and compassion. We become more self-referential. It's harder for us to look at other people's perspective. The hippocampus, when it atrophies, that's responsible for our memory and our new learning. So when you're under stress, have you ever struggled with learning something new? Right? It's like hard to remember, you become more forgetful. That's the hippocampus. It's not working as well. And then we see an overactivity in the amygdala, which is the threat detection center in the brain. So what happens essentially, and I look at it sort of like a light or electrical system. When we're under stress, the amygdala is lit up, right? The limbic system saying, hey, we're in a fight or flight, we're in danger. The prefrontal cortex sort of dims, so the frontal lobes aren't activated. And so with that difficulty in activation, we're not thinking and problem solving as well. And so a stressor can become an emergency rather than being able to think it through, right? So if we think about it, and I love Mark Twain's quote because this epitomizes for so many of us what happens. He says, there's been much tragedy in my life. At least half of it actually happened. So for many of us, that worry, those thoughts, no matter, even if they don't happen, creates these micro little bursts of hypoarousal in our system. So stress impacts our mind. And these numbers, this is again, way before COVID, but 20,000 to 60,000 thoughts a day, the average person has. And this part is really startling. 80% of those thoughts are negative. Now, they may not be the most negative thoughts you've ever had. They could be just routinely like, oh, I hope my internet doesn't, stop in the middle of this presentation today, right? Or, oh, I hope my daughter remembered her lunch. Like they're just these little bit of worried thoughts. And we have them, and they're often repetitive. In fact, I call them like top 10 songs, right? They're like these same categories that happen over and over again. They're not really the same. In fact, 95% are the same exact thoughts, so we're pretty repetitive as humans. And ironically, unlike Mark Twain, who said about half of his worried thoughts never happened, other studies say almost 85%. So, 3/4 or more of our worried thoughts don't actually happen. But we worry because we think it's a protection. We think that might help us to stave off something bad happening, but it doesn't work. It actually does the opposite. So I want to do a little practice with you right now. This is something that I like to do when I'm really gripped with worried thoughts, or if you're stuck in a kind of a pattern of having a repetitive worried thought. So I'm going to ask you to close your eyes for a moment. And again, finding your feet on the floor and taking a few breaths. And I'd like you to think of a situation that you may have been worried about recently. So you don't have to pick the most fearsome or upsetting situation, but something maybe that has been on your mind or has caused some anxiety, maybe something that you've struggled with for a while. Noticing how you feel as you come into contact with that worried experience. I'm having compassion for that. And now I'm going to ask you for a moment to take a breath and just slow down, feeling the belly all the way up to the top of the chest and then exhaling. So we'll take a few breaths. So stopping and taking a few breaths. And then observing your experience, noticing where in your body you feel the sensations of anxiety or worry. For some of us, it might be the chest, the belly, the throat. And just staying with that sensation. Sometimes I'll even bring a hand to that area, maybe hand to the chest or hand onto the belly. Bringing breath and awareness right to that area. You might even ask yourself, what does this stress need from me right now? Or what does this space in my body need from me right now? You don't have to have an answer, but maybe it's a little kindness. Maybe you just need time. Maybe you need a break. Taking a few more breaths. And then imagining the situation and seeing if you might proceed with a skillful action or non-action. What might be most helpful to do? And then when you're ready, you can open your eyes again, come back, and just notice how you feel. So that's the stop sign. And I like that practice because it just helps us to take a moment to come out of the worried mind and feel into our bodies. It doesn't, we're not trying to cure it. We're not trying to make it go away. We're coming into contact, we're breathing, and we're moving from that reactivity of that, think about that red zone in the fight or flight, coming back into perhaps the window of tolerance so that we can actually more skillfully attend to what's needed. This is another practice I like a lot, and I often do this with some of my corporate clients when they're going in to do a presentation, or the courtroom when I'm working with lawyers and people are getting really nervous. One of the women I was working with recently started having panic attacks every time she had to speak, especially in person because she's so used to being on Zoom. And so I had her practice this a few times, and she said it was really effective the last time she went into the courtroom. So first, I'm going to have you do it with me as well. So first, feel into one foot. Let's all press into our right leg and just feel all the muscles engaging in your right leg right now. And then release. And now press into your left leg and feel all the muscles engage. And then press both feet together at the same time into the ground, feeling the activation of the leg muscles. And then relax and take a conscious breath in through the nose and out through the mouth. And so this can be very helpful because when we're stuck in a thought pattern, it's really hard to get out of our head. But when we focus on a point far away from our head, which are our feet, right, the furthest part away from our minds, we can actually break that pattern and we start to feel the body again, literally feeling the ground beneath you. I love this practice because no one has to know what you're doing. You can even have your eyes open. It's a gentle way to remember, okay, I can feel my feet, I can feel my breath. And when we can get out of that fight or flight thought pattern, we can find that window of tolerance again. So those are just two quick practices that you can utilize anytime. The other thing I like to suggest is doing these practices when you're not stressed. I find that when we begin a mindfulness practice or a yoga practice and we're using it when we're gripped with anxiety, we're so far into that red zone that it can be hard to use the practices. And many people will say, I can't meditate right now. I'm so anxious. So if we can use these practices when we're calm, it's just part of our regular routine. We get up in the morning, we sit with our feet on the edge of the floor and on the edge as we're on our beds in the morning, whatever, just doing the stop sign and 2 feet, 1 breath. We can actually feel a little bit more capacitated to start our day. So we can use the mind to change the brain, to change the mind for the better, to benefit ourselves and other beings. So this is Rick Hanson, who wrote The Buddha's Brain and Hardwiring Happiness. And he looked at the underpinnings of meditation and what happens in the brain. So I love this idea that, in fact, when we can shift the way our brain is functioning, we help ourselves, but we also have more capacity to help other people. So each time you do a practice and help yourself get back into that window of tolerance, you're going to be a more effective colleague. You're going to be a more effective parent, partner, mother, daughter, son, father, right? We have this capacity when we are in the window of tolerance to be available to people around us. Many of you are familiar with mindfulness. And so just a really quick review of this idea of paying attention in a particular way, on purpose, in the present moment, and non-judgmentally. That key is really important to remember. Any of the integrative practices I'm going to discuss today have that non-judgmental component. As soon as we judge ourselves, we send that little response into our nervous system. Judgment, we have a little jolt. And it can bring us into a gray zone too, of feeling depressed, not worthy, poor self-esteem. Each thought impacts how we feel. And then Stahl and Goldstein, who wrote the mindfulness-based stress reduction workbook, I love this idea of cultivating awareness of the mind and body, living in the here and now. When we're living in our thoughts, we're not in the here and now. So the stop sign, we're in the here and now. That's an immediate way to come back into the present moment. So mindfulness meditation, Studio B has so many beautiful practices, short and long, around this idea of paying attention on purpose to something like the breath or the body. I want to talk a little bit more about this hybrid approach in psychotherapy. So many of us are aware of mindfulness as a practice, but as a psychotherapy, some of you may not be familiar with this, what we call in psychotherapy a third wave. The first wave of psychotherapy was traditional psychodynamic or psychoanalytic psychotherapy. The second wave, which was in the 1950s, all the way up into the 1960s and 70s, was more behaviorism and then cognitive behaviorism. But beginning in the early 2000s, starting with Marsha Linehan and others who created the dialectical behavioral therapy program, psychologists began to explore, how do I use these principles of mindfulness in my work with my clients? And they created what we call this third wave or hybrid approaches, combining Western psychology principles with mindfulness techniques. And this blending, I have found in my own clinical experience to be instrumental in helping people heal. Some of you have probably gone to talk therapy, and it can be very, very helpful to unpack material from the past, to look at your thoughts, to work on that. But you may have found that you still struggle with patterning. You still struggle with overreacting or having depression. The addition of mindfulness-based therapies can help with regulating the nervous system, finding more value and meaning in life, feeling more connected. And those are things that often traditional psychotherapy haven't been able to address as effectively. So we see now these integrative modalities, and some of you may be familiar with some of these, and they stretch not just for psychotherapy, but also for substance use and relapse prevention. So can we take the best of both of these sciences and combine them for more effective treatment? And so the research is really exciting in terms of the efficacy of mindfulness-based therapies, a large treatment effect for anxiety and depression. And remember, when I talked about the statistics in the beginning, those are the two most common conditions. Really exciting is with some conditions like major depression that tend to be episodic, which means they happen on a regular basis. It's not like a one-time episode. It can happen over and over again. That with a regular mindfulness-based practice, it shows that people can maintain longer and longer periods without having more episodes. So that's really exciting. So why does this work? So there's been a lot of exploration by researchers looking at, well, what is specific about these hybrid modalities and including mindfulness that are now making these robust findings? So number one, we know that mindfulness in general without psychotherapy can improve mental health. There's a lot of good research showing that it improves mental health alone without even doing the psychotherapy piece. But other things can play a role too. I talked about the worried thoughts, right? Our 60 to 80,000 worried thoughts a day. Mindfulness helps us reduce that rumination. When we're in the present moment, we're working with coming back rather than getting stuck in that loop. So mindfulness and psychotherapy combined can help us not only identify the negative thoughts, but reduce them. Self-compassion and compassion from a therapist together, feeling valued, respected, and cared for both by yourself and someone else. The relationship between you and a coach and you and a therapist is the number one most important factor that people cite in terms of whether therapy was effective, the number one. So the relationship matters and compassion matters. Reduction in cognitive and emotional reactivity. Can we control how we react to things? The more that we can respond to stress and not get overactivated, the better we're going to feel. So emotion regulation, which is key in many of these psychotherapy toolkits, right? Is what do I do when I get triggered? And then creating a toolkit using mindfulness interventions, using cognitive strategies together can be very potent in terms of improving emotional capacity. And this last one, psychological flexibility. Can I be present with difficulty and still be okay? Can I change something if I'm struggling with it? Or am I stuck in the same pattern over and over again? So mindfulness gives us increased flexibility, decreased emotional reactivity, improvement in this, recurrent negative thoughts. And psychotherapy creates a toolkit, a way to put all that together so that we can identify and then implement these practices in a compassionate environment. So we can utilize mindfulness practices daily. And I know we don't have time to do regular practices. We have lots of apps. We have Studio B has so many. I was so struck in looking at how many short and longer practices you can utilize for stress reduction for mindfulness. The idea is starting from a toolkit perspective, starting with a few slow practices, short practices, like the two I gave you, a couple of breath awareness practices, knowing how that can start to decrease reactivity, start to help us with that rumination component that we talked about. And then mental health. So if we're looking at this hybrid approach, individual counseling, a personal coach, yoga therapy, working with someone who can do mind, body, or somatic experiencing, support groups with people that have similar struggles, 12-step if there's some substance use or other addictive behaviors, and often a combination. I like to think about mental health as a holistic practice where we're using a team or a toolkit and a team of professionals, wise-minded friends on the path with us. So Viktor Frankl has this beautiful quote, which I think about so often with mindfulness and mental health. Between a stimulus and response, there is a space. And in that space is our power to choose our response. In our response lies our growth and freedom. And that's really what mindfulness provides us, that space, so that we can begin to harness some of these tools. So I want to come back now and see if there's any questions or comments from the audience. What I'm observing in a positive way are people are talking more. People are showing up to webinars, and in corporate environments, I work primarily in corporate environments now, that it's not just we'll do a seminar or we'll do something here and there, that there's a much more dedicated effort for well-being because employers know that the employees need to have mental health as much as they need to have physical health and well-being.
I definitely. There's
Hi, I can hear you okay.
Okay, so I am Lindsay. Nice to meet you. And I just wanted to say I'm definitely going to incorporate that foot mindfulness, the one tap, the second tap, and both. That sounds like something that will really be beneficial. And I can understand the mind to the body and how that would help ease any anxiety. So thank you for that.
You're welcome. Yeah, that practice is so nice. It comes from the somatic experiencing psychotherapy field, literally that idea of the feet being the furthest part from the head and utilizing the body's resources. So, and it's simple. I love practices that are simple and we don't have to overthink it, but it can immediately break that discursive pattern happening in the mind. I also like practices that nobody has to notice and you don't have to go into a quiet space, from a practical standpoint. So, doing that when you're walking, you can pause and stand, lots of different options for that.
Tracey,
Yeah.
do you have any kind of top of your mind statistics as far as how mental health affects physical health? Because I feel 100% sure that mental health issues do result in people having physical health issues. And I'm just wondering if you have, again, without a whole lot of detail, any kind of high level data on that.
Yeah, so it's a great question because there's two different things. So mental health, absolutely. We know the stress response and increased cortisol in our body can create issues with organs. So too much stress coursing through, too much cortisol, and there's a whole axis of things that happen can increase blood pressure, can cause cardiac issues. So people often have with a lot of stress, and this goes back to the 1970s where they looked at like that type A personality. Herbert Benson and others out of Harvard noticed this increased risk of cardiovascular and early heart attacks and strokes in folks that were in high stress jobs. What we know now too is it's a complicated system where many people with mental health issues have co-occurring physical. So sometimes the physical issues can cause mental health issues, and sometimes health issues can cause physical. 50% of people after having a heart attack have depression. So there's an intricate relationship we're only beginning to understand, but there is a high co-occurrence. So it's a great question. When our sleep and our appetite and our cardiovascular health are implicated, we don't feel well, right? And so it makes sense that we are at risk to then go on medications, which can then further cause some mental health side effects. Yeah, so there's a high co-occurrence.
Thank you.
You're welcome. Any other? Let's see. So Eden was asking about the work of Tracey Shore. No, that's a great resource. Yeah. I think, when we're thinking about treatment for anxiety, depression, to be really interested in a multi-pronged approach. So one thing that sometimes happens with yoga and anxiety is that if we think it's going to cure anxiety and depression, we get disappointed, or we feel like this doesn't work and we throw it out before we actually have enough other resources in place. So I love the idea of looking at anxiety, depression as a holistic approach where we can use yoga, we can use mindfulness, we can use talk therapy, sometimes medication, sometimes spiritual domains that can be really helpful. So we want to look at it in a wide lens. So I think it's super helpful to integrate each of these areas and think about which area you might want to work on. It doesn't have to be all at once.
Right. Her work was actually really interesting because it started out, she's a neuroscientist as well as a psychologist, and it started out looking at just brain remodeling and brain and growth.
Mm-hmm.
And I gather that this protocol has been pretty effective with women who have been in traumatic situations, with people with PTSD, and it seemed to dovetail with what you're talking about in terms of, bringing in all these different levels of modalities. Yeah, but
Yeah,
I believe that she has some. I first encountered her at the Brain Summit, which was probably 2 years ago. So she probably has some more recent data on it that it looked pretty exciting. I mean, as something to offer, because if you do 1 hour twice a week, it was as effective as the medication.
Thank you. A question about mindfulness and menopause. Yeah, so there's been some interesting research using breath work for menopause, including with hot flashes, some of the depressive symptoms. So, but in particular, they've been looking at that correlation between being able to use slower breath when a woman is struggling with repeated hot flashes. And there's been some nice data supporting the use of it. So I think hormonal fluctuations and changes, mood changes, and certainly physiological arousal or hot flashes, mindfulness can be very effective as part of, again, that whole practice of self-care. So free meditation apps. Yeah. So there are lots of free meditation apps out there. Breathe is a really common one. Calm, Headspace, they have an introduction that's free. YouTube actually now has a lot of free programs. So I like to, look at the free ones sometimes, as a good basis to get folks interested. I Breathe, it's called I Breathe, also does like an in-breath, out-breath practice where you can measure how long you're breathing in and how long you're breathing out, which is called coherent breathing, which can be very helpful. Yes, awesome. Yeah, so we have complimentary 14-day trial. And I love those trials. I think those are really helpful for whatever you're interested in so that you get a sense of it, because that builds in the practice when we start to do something on a daily basis. And do it with, and the best thing I can offer you too is if you can do it with your coworkers, because when, many people say, well, I downloaded a bunch of apps, but I never use them because you might go to a talk like today. So I'd say, like, if you can get one other person to do it with you and have an accountability buddy at work, especially. One company I'm working for now, they use a phone call and they'll all dial in and just do it together for a few minutes. So there's just different ways that you can incorporate it. But when it becomes a regular part of your practice, and especially if you have someone to do it with, it can be really helpful. So I'm aware of our time today. I'm so glad for these questions. I know we can, I'm sure, dialogue for a while, and thank you for sharing some resources as well. I'm so grateful to Studio B to come and present, and to Jennifer and all the amazing work you guys are doing in terms of helping people improve their lives.
Thank you so much, Tracey. It's just been an honor having you here with us today. And thank you all for spending time with us, for being fantastic listeners and participants in today's program. Please feel free to reach out to us if we can provide you with any resources. We will have a recording of today's presentation uploaded on our blog within the next couple of days, and certainly have that out on social media. So we appreciate you being here, and we hope you have a wonderful afternoon, evening, wherever you are dialing in on in the world. Thank you for being here.
Thank you.
Thank you, Tracey, so much.
Well, everyone.
So grateful. All right. Have a good day, everyone.